First of all, I would like to thank the organizer for inviting me today to share some of the data from my laboratory. My lab develops alternative large animal models for the acute radiation syndrome, ultimately for testing of medical countermeasures. But what I will present here today are the data from a pilot study. No? Yes? No? Yes. Closer. Data from a pilot study of a model of late effects, a Minipig model of late effects, and the animals were irradiated at clinically relevant doses of ionizing radiation, which is 2 gray. I come from the Armed Forces Radiobiology Research Institute. This is a part of the Department of Defense. So here I have to say that what I'm about to say is just my own opinion and not that of the DoD. Okay. Or the university, if that matters. So we learned in these past 2 days that cancer is not the only health effects of radiation. And we also learned that biological systems are a lot more sensitive than we expected. There is a little bit of evidence indicating that irradiation causes effects on the endocrine system. This evidence comes from epidemiological studies of childhood cancer survivors. For this population, when the head is in the field of irradiation, these children develop deficiency in growth hormones, both GH and IGF-1. And this is very dangerous because it could lead not only to impairment of growth, but also to development of obesity, metabolic syndromes, diabetes, and hyperinsulinemia. So all diseases related to impaired metabolism. There is also data indicating that there is an increased incidence in type 1 and type 2 diabetes among a population of the A-bomb survivors, as well as among individuals in the Belarus population who were exposed to higher doses of irradiation as a consequence of the Chernobyl accident. We talked extensively about how the cardiovascular system is affected by irradiation, and here I just want to make the point that the doses of 0.5 gray, perhaps even lower. How does this work? Like this? Yes, doses of 0.5 gray or even lower cause increased risk of cardiovascular diseases, but what is very relevant for my talk is that they also increase the risk for collagen deposition, fibrosis, abnormalities in cardiac conduction, and the associated arrhythmia. We also learn from breast cancer patients that if the heart is in the field of irradiation at doses as low as 1 gray, there is a small but significant increase in the risk of ischemic heart diseases. There is a beautiful association, actually, between cardiovascular diseases and metabolic syndrome. And in several cases, the link of this association is the insulin-like growth factor 1 deficiency. IGF-1 is a small anabolic hormone that is produced primarily in the liver, but it can also be produced by muscle cells, for example. It is under the control of the growth hormone from the pituitary gland, and it's regulated by binding protein. As the name says, insulin-like growth factor, IGF-1 has a ton of really critical function towards organ development, for example, function and homeostasis. It induces the growth of muscles and bones. It's involved in the metabolism of lipid and proteins. And very, very important for us, it is considered the guardian of the cardiovasculature. The importance of the relevance of IGF-1 deficiency for health conditions is exemplified among the human population by several studies. The Dan Monica, for example, it's a prospective case control study. For this study, 600 individuals were enrolled. At the time of the enrollment, they were healthy. And these individuals were followed over 15 years. And the study proved that lower than normal IGF-1 levels were associated with increased risk in coronary heart disease. A similar study, a longitudinal study on the Laron dwarfs, a population in Ecuador characterized by IGF-1 deficiency and small size of the body, indicates that this population has a shorter lifespan, has cardiac atrophy and impaired cardiac performance. More than half of these individuals die because of stroke and cardiovascular diseases. In the population in general, IGF-1 deficiency is associated with an increased risk of cardiovascular diseases. And once again, I would like to stress the fact that IGF-1 deficiency is associated with abnormality in heart function. What did I do? Once again, I'm back. Once again, impairment of contractility, arrhythmia, collagen deposition, endothelial dysfunction, in addition to usual oxidative stress. The mechanism of the role of IGF-1 deficiency have been proved by the use of knockout mice. There's a large number of knockout rodent models where IGF-1 production has been reduced or inhibited. And beside the common trend that these animals are all small, they all share defects in the heart. So cardiac atrophy, impaired cardiac contractility, endothelial dysfunction, an increase in oxidative stress, abnormal microvascular development, and impaired systolic and diastolic function. So IGF-1 is really, really, really critical for proper function of the cardiovascular system. In addition to that, I mentioned that IGF-1 is also important for the development and the structure of basically all the main organs. In the kidney, IGF-1 associated with the renin-angiotensin system to regulate hemodynamics. And it also regulates production of nitric oxide, therefore regulating the filtration rate and glomerular perfusion. Among its other functions in the kidney, IGF-1 regulates the reabsorption of electrolytes such as sodium phosphate and calcium. For the liver, it's primarily involved with its structure. And IGF-1 deficiency is associated with early liver damage. So why do I make such a big deal of IGF-1? Well, it looks like IGF-1, it's really important for the etiology of radiation-induced damage, whether that is long-term radiation-induced vascular dysfunction, where the IGF-1 PI3 kinase AKT signaling pathway is inhibited, and these are findings from rodent models, or whether it is the acute response of the animal model to radiation. And these are data from my lab. As I said, I use a Minipig model. This is a model of hematopoietic acute radiation syndrome. In this case, the animals were irradiated at a lethal dose that induces 50% of lethality. And what we saw was that the animals that actually died because of radiation damage, they were characterized by extensive hemorrhage. Not only that, but they were also characterized by selective inhibition of the IGF-1 pathway. Now, IGF-1, I mentioned to you, is the guardian of the cardiovasculature, and it does so by regulating the production of ET1, which is a vasoconstrictor, and nitric oxide, which is a vasodilator. The equilibrium the coupling between production of ET1 and nitric oxide is what regulates the vascular tone. Once these two molecules become uncoupled, that's the definition of endothelial dysfunction. So this selective IGF-1 inhibition is a term that has been produced to define a condition in diabetic patients where oxidative stress and mediators of diabetes were selectively inhibiting the production of nitric oxide. The PA3-AKT kinase producing nitric oxide. And that, in diabetes patients, was associated with increased risk of cardiovascular diseases. In the Minipig model, we basically see the same thing. We saw that the oxidative stress and the ROS caused by exposure to irradiation were selectively inhibiting the production of nitric oxide, whereas the production of ET1 was remaining basically the same, causing endothelial dysfunction and basically contributing to the lethality of the radiation-induced damage. And we proved that this story was actually true and relevant by administering Neulasta. Neulasta, as you all know, is the pegylated form of GCSF. GCSF is the first cytokine approved by the FDA for the treatment of radiation-induced myelosuppression. GCSF is known to activate AKT in addition to ameliorating the recovery of the bone marrow, right? So if inhibition of AKT and production of nitric oxide is really, really that important, then GCSF, right, better be able to restore it. And that is exactly what we saw. So this evidence made us feel really comfortable that IGF-1 pathway, it's really important in the etiology of radiation-induced damage. So once again, this model was obtained by irradiating the animals with total body radiation to gray, which is a relatively low dose of radiation if you compare it to other animal models. So let's recap. We said that even low doses of radiation can affect the endocrine system and the cardiovascular system. We said that IGF-1 is really important for the homeostasis of both systems. We showed you evidence suggesting that radiation can impair the IGF-1 pathway. So can we put all this information together and see if we can come up with a model that is sensitive to radiation, that is known to develop cardiovascular damage as well as metabolic impairment as we assess it by clinical chemistry parameters, and that is sensitive to low doses of radiation. There are already available animal models of delayed effect of radiation, namely the NHP and the rodents. These are great models that have been extensively characterized. Some of the delayed effects we just heard were the position of collagen in the heart, that was from the rodent model from the speaker before me, and the NHP has shown evidence of onset of diabetes, in addition to changes in the lung and in the intestine and in the immune system. What makes the pig so different from this other model is the requirement for the radiation dose, right? So these animal models usually require pretty high doses to show changes. The Minipig, it's sensitive. It's sensitive to irradiation. My lab works with two Minipig strains. One is the Sinclair Minipigs, is pretty large, and has an LD50, a lethal dose that causes 50% lethality of about 3 gray or so. The Göttingen Minipig is much smaller animals. It is prone to obesity, and it has a much lower LD50 of about 2.1 gray. Both animals are characterized by inhibition of the IGF-1 pathway following lethal doses of irradiation, as well as alterations in the cardiovascular and in the metabolic system. So for the low-dose late effects model, I chose the Göttingen Minipig because 2 gray is a clinically relevant dose. And here is the study design. So this is the pig. It arrives at the institute where we quarantine them for 2 weeks approximately. At the time of irradiation, we use a LINAC, 6 megaelectron volt LINAC, 2 gray dose. We shield 5% of the bone marrow to ensure that the animal will live, to ensure that there is enough bone marrow to overcome the hematopoietic ARS, so that we can follow the animals for a long time. This is the LINAC and the table. We position the animal, and this is the portion of the legs that is spared. The endpoints that we collected were the general indicators of health, including weight, a normal CBC count, a clinical chemistry, inclusive of kidney and liver panels, as well as lipids. We measured blood pressure. We did histological assessment, and we looked at the IGF-1 pathway. This slide shows a CBC count. And you see the immediate drop right after irradiation. This is expected. And because there was some bone marrow shielding, the recovery is actually pretty fast. And all the animals survived. We then measured IGF-1. And we saw this is pre-irradiation value. We saw an initial spike in IGF-1 levels. And then for all animals, a decline over time. Because of all I told you about the IGF-1 role and its function in protecting the structure and the function of the, we then decided to evaluate whether this radiation-induced IGF-1 deficiency was associated with any changes in the main organs. And we started with the body weight. IGF-1 regulates the growth of muscles as well as bones. The Göttingen Minipig is a very reliable model, very, very reliable model. These animals gain 1 pound per week, even if they are irradiated. And this is the control sham. And you can see that the animals that were irradiated ended up losing the ability to grow as fast as the control animals. The histological assessment was done at, this is wrong, it's 120 days. We stained the organs with H&E as well as Masson trichrome staining to evaluate the position of collagen. This is the heart, unirradiated, and this is the irradiated heart. And you can see that there is deposition of collagen. We quantify that, and there seems to be a significant difference between non-irradiated and irradiated animals. The kidney also, there were signs of deposition of collagen. And this is important because I've shown you before that IGF-1 deficiency was associated with deposition of collagen in the heart, as well as with changes in the ability to contract and onset of arrhythmia and cardiac atrophy. So we measured the heart rate over time. If you remember, IGF-1 went up and then down. The heart rate goes up and then it goes down. It mimics perfectly the pattern of IGF-1, actually. And these are the cases of arrhythmia. So 1 means present, 0 is absent. And we don't see arrhythmia before irradiation. but we do see it after irradiation, as you would expect, based on actually human data. Another finding that was pointed out by the cohort studies, human cohort studies, is the cardiac atrophy. Now, this is the IGF-1 pathway, right? This is the receptor in the animals that were irradiated and in the shams. You can see that the receptor is not phosphorylated in the late effects animals. Unlike the acute studies, AKT is still active, so these animals are not dying, right? But this time, the ERK signaling, which, as you all know, is involved in the generation of heart hypertrophy and growth of the muscle, is inhibited. In terms of renal function, these are markers of renal function. There are increased albumin and urea and a little bit creatinine as well, suggesting that the kidney is not working as well as it should. IGF-1 deficiency was also associated with the inability to reabsorb electrolytes, and this is exactly what we see in this model, exactly the same. Liver panel, ALT is another well-known marker of liver damage. It is induced. Normally, when you see increase in ALT, you also see increases in alkaline phosphatase. However, alkaline phosphatase is also a marker of bone formation. IGF-1 is inhibited. IGF-1 is the one that induces the formation of bone. So this is really not too surprising. In terms of lipid metabolism, we had both induction and inhibition of formation of lipids. And this is, again, it is expected because these animals are not inbred. They behave like people. So you would expect variability in the results. And so to summarize, the PBI model might be useful to assess the delayed effect of irradiation in organs exposed to clinically relevant doses of irradiation. I showed you that IGF-1 levels decline over time. And the deficiency in IGF-1 associated with the organ changes that you would expect, which, so the changes consist in slower growth and impairment in heart function. As we have seen, the rate was different, the rhythm was different. We saw the position of collagen, and perhaps what will lead to atrophy, generation of atrophy, inhibition of the ERK signaling. In kidney, the function and the structure were affected, as well as the reabsorption of electrolyte. In the liver, the lipid metabolism was clearly affected by irradiation. So I think that IGF-1 deficiency could be the link that explains the onset of this metabolic dysfunction that we see associated with exposure to irradiation. Thank you.
Thank you very much.
How do you explain that it is not produced anymore after irradiation? If it's produced by liver, you don't kill all the producing cells.
So I don't know why the deficiency, because it's a relatively low dose of radiation, right? So we would have to analyze the pituitary gland, because that's where the growth hormone is being produced, and IGF-1 is under the production of GH. So we would have to look at that. Now, I also want to mention that this Gotting and Minipig is prone to obesity. So is this all part of this metabolic dysfunction that we are looking for? It is possible.
So you are saying that this Minipig would have a decreasing level of IGF-1 anyhow, but by irradiating it, you accelerate the phenomenon?
It will have a decrease in IGF-1 with age for sure, like humans, yes.
Thank you very much once more, Maria.